we will continue from where we left off, with skin problems and dermatological diseases. In our lesson, we will discuss freckles, spots, chloasma, melasma, leukoderma, albinism, hematomas, telangiectasia, and some pigmentation disorders. Freckles are small brown spots formed by a very active group of melanocytes that are also present on the surface. They usually appear around the age of 5 in fair-skinned, blonde or red-haired children, and accompany them for most of their lives. From a cosmetic or aromatherapeutic perspective, it is not possible for us to intervene with freckles. Generally, we can recommend that the person live with and love their freckles. Unfortunately, there isn't anything else we can do. Lentigines are typically larger brown spots that are present from birth on the skin. There is nothing we can do about them. Melasma, on the other hand, are brown spots appearing later on sun-exposed areas of the skin. There is also chloasma, which we can call the sibling of melasma. Chloasma is the term used for melasma that occurs during pregnancy, whether it is melasma or chloasma. The cause of these conditions should be investigated. Is there an underlying genetic problem in such skin conditions? Is there a hormonal disorder? These should definitely be evaluated under the supervision of a physician. As support, you can also prepare special formulations for blemished skin and provide recommendations. The skin problem we call vitiligo is caused by an issue in melanin synthesis. It is a condition with an unknown cause. It is observed as white spots on the skin. Although color uniformity can be achieved with various formulations, quackery should not be practiced in such a condition. Albinism is a congenital problem. In such skin, melanocytes are present, but melanin production cannot occur. Naturally, there is no pigment in the body. Individuals with this condition are fair-skinned and blonde. A hamartoma is a tumor-like formation that arises from the abnormal development of tissue in terms of structure and proportion in a specific area. They are lesions caused by blood vessels located in areas of the skin with permanently dilated capillaries. We can also classify these lesions as port wine stains, strawberry marks, and telangiectasia. A port wine stain occurs as a result of the permanent dilation of wide capillaries, appearing flat and red or purple in color. It can sometimes cover half of the face. It is usually present from birth and lasts a lifetime. It can be removed with various medical treatments such as laser therapy. A strawberry mark is a bright red capillary mark. It can appear at birth or within a few weeks after birth. Generally, it disappears around the age of 5, and by the age of 10, there is no mark or scar left. The child has regained normal skin. There is nothing that can be done for this, and it is a spot that does not require treatment. The dilation of capillaries, known as telangiectasia, is also referred to as spider veins. Small lesions are more often due to the permanent dilation of capillaries rather than their rupture. They are more commonly observed in dry skin, sensitive skin, or neglected skin. These formations may increase with age. It should be recommended that excessive makeup should not be applied to such skin and that they should avoid heat. You can recommend cosmetic or aromatherapeutic blends for dryness or sensitivity support. We can also talk about spider telangiectasia, which branches out into radial arms. Such formations can be observed due to changes in hormone levels in conditions like liver disease or pregnancy. Moles are formed by the aggregation of cells due to melanocytes located in the lower dermis. Melanomas are irregularly bordered lesions that originate from moles or the melanocytes of the skin. If there are abnormal growths or changes in moles, it is essential to see a doctor. And yes, what we have listed so far are of bacterial, viral, and fungal origin. We discussed diseases related to sebaceous gland problems and pigmentation issues. There are also some conditions with unknown causes. In problems like psoriasis, eczema, excessive hair growth, allergy, or urticaria, the underlying cause is usually not known. and these can also develop due to a serious problem. Therefore, the formulation must be prepared under the supervision and approval of a physician. Psoriasis is a non-contagious disease characterized by chronic inflammation. It is due to abnormal keratinization. Please remember this when describing the structure of the skin. We mentioned that in a healthy individual, it takes about a month for our cells to be produced in the basal layer of the epidermis, and then move to the layer we call the stratum corneum, where our dead cells are shed. In individuals with psoriasis, this 1 month period occurs in as little as 4-5 days. Therefore, keratinization involves the accumulation of dead cells. The skin cannot renew itself well. In these patients, in addition to keratinization, there may also be flaking and accompanying itching. Eczema is a disease that manifests with symptoms such as itching, oozing, or crusting. There are many types: wet eczema, scaly, dry eczema, and fissured eczema, for example. It is a type of skin inflammation that must be treated under the supervision of a physician. For such a skin problem, you can only recommend supportive products. Hirsutism, which we refer to as excessive hair growth, is a condition characterized by the transformation of vellus hair, which is normally found on our face or body, into terminal hair, meaning it becomes thick. This can be encountered due to hormonal imbalance, or it could be a genetic problem. Therefore, it is a condition that must be thoroughly investigated. There are several methods available for hair removal, such as electrolysis, needle epilation, and laser. These should, of course, be performed by trained professionals. Especially with methods like needle epilation, there is a high possibility of leaving marks. An allergy is the development of hypersensitivity and an abnormal reaction by an individual to a substance that does not affect most people. Which substance will cause the allergy, or at what age the allergy to that substance will occur? The exact cause of the reaction is not known. Therefore, it is among the conditions with an unknown cause. Urticaria is a short-term reaction of the skin to an allergen or to excessive stimuli that cause raised welts. There may be swelling and itching on the skin. A white bump with a red area around it or can be observed. Yes, dear friends, we have now completed our lesson on the general structure of our skin problems, and dermatological diseases. See you in the next lesson. Goodbye.